Hi guys. All right, so I'm going to go through this chapter a little bit quickly. It is 58 slides long. Um, so if you have any questions, make sure you address them to me via email or group me, and I'll be happy to answer any questions. All right, so chapter 20, nursing care of patients with HIV disease and AIDS. Define HIV and acquired immunodeficiency syndrome. Explain how HIV is transmitted. Explain tests for diagnosing HIV. Describe the prognosis for HIV and AIDS, and develop a teaching plan for prevention of an HIV infection. Identify prevention measures used to decrease infection and opportunistic diseases for patients with HIV. Develop a teaching plan for a patient with HIV receiving antiretroviral therapy. Plan nursing care for patients with HIV and AIDS related to medications, co-infection prevention, and maintaining nutritional status. Chronic infection with treatment. HIV, chronic infection with treatment. So it's no longer a death sentence, if you will. They have a lot of drugs to help, antiretroviral drugs, to help prolong life and also increase, I guess, the quality of life as well. Sometimes a progressive immune disorder, if it's a constant battle. I mean, there is no cure for HIV. So if the patient becomes under stress or becomes ill, it can increase and excuse me, my dog is snorty. It can become more, the patient can be just progressive. It progresses to a worse immune system, a worse immune disorder over time if the antiretroviral drugs are not, the regimen is not adhered to. HIV untreated results in AIDS over time. Yes. So it could take 5 to 8 years if untreated to turn into AIDS. It can go dormant. However, if it's untreated, it can result in AIDS. AIDS is a final stage of HIV infection. There's no cure, and it is fatal. It can be fatal, and it likely will be fatal. The incidence in 2015 is 1.1 million are infected with HIV, and 15% are unaware of their infection status, which means that, I mean, that's kind of scary due to the point that if you're not aware you're infected with HIV, there is a higher chance and likelihood you can spread your infection. In 2016, 39,782 newly infected with HIV. 45% are African Americans, which is the highest percentage, and 19% are women, which is declining. And that could be for various reasons, but because women are more likely to contract HIV because of the surface area. You can imagine if you think about sex, um, you know, there, I guess, I mean, think about the just anatomically, the hole is bigger, right? So the chances of contracting HIV are going to be 50 times more likely than if they're male. That is with heterosexual sex, however. I mean, yes, so homosexual sex is a little bit different. So if you think that through, heterosexual females are 50 times more likely in that kind of relationship than males to get HIV. HIV subtypes. HIV-1 is a primary type and it's worldwide, and then there's HIV-2, which is primarily West Africa. All right, so HIV pathophysiology, there's 7 steps. There's the binding step, which is CD4 receptors of the host cell. So we're talking let's talk about exposure to HIV. All right, now we need to understand that HIV doesn't live outside the body for longer than 8 seconds. So, contracting it with a needle is likely, especially if you are sharing needles during drug distribution. So say somebody who's infected with HIV pokes themselves with a needle and then shares a needle with somebody else who's also doing IV drugs. That transfer could be within 8 seconds, and that is going to be a good chance that a person can catch HIV in that way. However, um, you know, let's say you accidentally get poked with a needle that's been laying there for who knows how long. That even though it's scary because there's still other things like hepatitis C and everything else, HIV doesn't live outside the body for longer than 8 seconds. So there's some comfort in that. But anyhow, once you get exposed to HIV, it's in the bloodstream. Um, the CD4 receptors of the host cell. So what it does is it says, okay, let me get to the CD4, and then membranes fuse around it. So the virus attacks the cell, fuses into the membrane, and then a reverse transcriptionase happens. The viral RNA to the DNA. It attacks the DNA and changes the cell to become, and then integrase happens. So an HIV DNA into the host cell DNA. Then replication happens. And now we have HIV cells in the host cell and they replicate each other and become strong, right? So the packaging viral envelope for the new HIV is happening. Now they release the protease cutting of the HIV proteins. Now, how is this going to affect our immune system? These new HIV cells are now they feed off of basically our T cells, right? And our B cells. So see now it kind of shows the looks of it. It's attacked it, and now it replicates it, and it grows in our body. Not not similar to cancer, but in a way, there's not really much stopping it. Now, where antiretroviral um, drugs happen is we want to stop the growth of HIV, right? And they attack the enzyme they slow the enzyme that helps inhibit the binding of this is it, antiviral drugs and the 7 steps. The binding cellular chemokine receptor type 5 antagonists block the attachment. So now the HIV can't bind, the virus can't bind to the cell wall. And there's also fusion inhibitors. So I know you're like, what's the difference between binding and fusion? Well, um, good question. I don't know. No. They fuse whenever it fuses. So binding is one thing, but fusing into the cell wall to get inside of the cell and get to the nucleus and make the RNA is also a way antiretroviral drugs block the growth of HIV. So, and then there's reverse transcriptionase. It's stopped by non-nucleoside reverse transcriptase inhibitors and nucleoside reverse transcriptase inhibitors. So whenever somebody is taking antiretroviral drugs, we're blocking this in so many ways. And in every way is needed because of the different stages and the different ways the drugs are distributed in our body. So they can be taking 6, 7, 8, 9, 10 medications to help block the growth of HIV. I think things are getting better though now, where they don't need quite as many medications to do the same thing. Integrase and integrase inhibitors, replication prevented by the NRIs and NRITIs and packaging. There's budding protease inhibitors as well, so that just keeps them from being able to reproduce. So HIV progression, the initial infection, right? And then there's clinical latency, which they're symptom free. They don't even know they have it. And then after a while, the CD4 T lymphocytes start decreasing. Remember, because this is what they're attacking, right? And then 8 to 12 years until symptoms of HIV may occur. And then symptoms are weakening the immune. immune system. So we need to think, what are some things that show a weakening immune system, right? TB, opportunistic infections can occur, like yeast infection is the most common one. Um, Pneumonia. Uh, I mean, there's so many, and also there's a sarcoma, which is your sores. They have like skin lesions. Also, mouth sores are common for AIDS patients as well, which is really hard because they already have no appetite, a very hard time with nutrition, keeping food, nausea and vomiting, diarrhea. But on top of that, their mouth is sore to eat. So nutrition is always a priority. But the biggest priority in caring for patients with HIV is to keep them from getting infection, because that is, a simple cold can basically cause pneumonia and they can die from. People don't typically die from AIDS. They die from infections because of a low immune system. So AIDS, CD4 T lymphocytes are less than 200 cells per microliter. CD lymphocytes are less than 14% of the total lymphocytes. They cause opportunistic infections and cancers. So here we go. A patient with HIV infection phases, as they go through their latency period, at first it dips down a little bit, their lymphocytes, if you notice, and then it goes dormant. And they don't know. 1 to 4 weeks is the first time they get the infection, and after 2 months, they can get a positive HIV antibody test, but remember, when you're first exposed, you won't test positive until after 2 months of being exposed. So you might have flu-like symptoms for the first 1 to 4 weeks, and then after 2 months is when your test will come up positive. That's why whenever you think that you were exposed, depending on the time period, they might have you come back and test again in a couple of months, and that's just protocol. So they're anti-symptomatic, and then after so long, after what was it, 12 years, early symptoms of HIV infection may happen, and then AIDS comes into play. And then once the CD4 and the T lymphocytes decrease to the point of gone, then death usually occurs, because there's nothing there to recognize infection, so that our immune system, because remember, the T cells are kind of like our memory cells in our body that say, hey, there's infection here, everybody gang up, let's go. And those guys are gone. So there's nothing to say, hey, infection, come on guys, let's start working. And because of that, there's nothing protecting them. Prevention and education to manage the epidemic. What we want to do is prevent it from spreading. And a lot of people, I mean, you guys, so much has progressed since then. People were so scared. I know a lot of you are too young to realize during this time, but this is when the safe sex really took off, and it was a big deal. And also healthcare provider. I mean, healthcare workers didn't even wash their hands back in the day. In the 80s, they were so scared. I mean, gloves were not a normal thing to find on the floor everywhere. People would just, you know, give suppositories with a finger condom on. It was ridiculous until HIV came about, and then all the healthcare workers were scared, 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 and they were using full suits. Nobody knew. It was kind of like the beginnings of COVID, where nobody knew how long it stayed in the air, and everybody was just overreacting and causing disruptive behavior, and they were very scared and became very I mean, most of the time, it was considered a disease that was transferred by gay people, so people were attacking them and becoming just awful. And it was so untrue, and it was false to believe that because really, I mean, anybody can get HIV, and everybody was getting it. So it was a very scary time until the CDC came through and said, okay, this is how it's transmitted. And once they got it, realized that it's not, if you wear gloves and wash your hands and use safe sex and don't share needles, and right now, these are all normal things for you in your generation. Like, ew, who would ever share a needle? Ew, you mean nobody would wash their hands when they were changing people's briefs? That's so gross. You're right, it is gross. And then, but that's what happened. And now we consistently use gloves. We consistently use our basic, PPE. This is universal precautions. And that's where HIV did, is they actually established universal precautions. And all it is gloves. They're not on, you don't have to wear a full, robe and a mask or anything like that. You just need to wear gloves when touching bodily fluids. That seems pretty simple compared to the other disease processes we've had to go through since then. So the recommendation is to teach all ages from older children through older adults. All right, so 2014, 70% of HIV patients were over the age of 50. Why? Because this generation suddenly were becoming single, and they were married during the AIDS time, so they didn't pay attention, and they weren't using safe sex. So that's kind of what happened on that end. Diagnosed late when AIDS are present, less likely to be tested for HIV. They're less likely to use condoms. Increased risk for aging and immune system, and women are at an increased risk. Like I said, women are at increased risk because more surface area, right? That's basically the idea. Go away. My dog is bugging. Stop. Excuse me. All right, so the HIV mode usually is through blood, but it can also be breast milk, semen, and vaginal secretions. HIV is not spread casually. You cannot get HIV through saliva or sweat, meaning you can still kiss somebody, you could still share a cup of water, you could still, um, you know, it it doesn't get carried in the saliva. Okay. Um, it is blood, breast milk, semen, and vaginal secretions. So HIV routes of transmission are sexual, parenteral, which means through a needle, or perinatal, which means yes, if a mother is HIV positive, she can pass it on to the baby. We do start the baby on antiretroviral drugs of known HIV patient mothers immediately after birth, and they are not to breastfeed after. So prophylactic, there is some prophylactic, like there is now a vaccination that patients with that are at high risk for being exposed to HIV can take it, and it's effective prevention for those at high risk. Antiretroviral drug. Truvada is what it's called, and it's a daily pill if you take it consistently. It's used with other transmission precautions. So it doesn't mean just because you take this pill, you're not supposed to use a condom. Of course, use a condom, but I mean, let's just say this. Let's say that you are a patient that is at high risk because you're sexually active and you're young, and you also have, like, say, um, another STD, like, oh gosh, what was I gonna say? the canker sores, what are they called? Herpes. Let's say you have herpes. Well, that is potentially an open wound in a sexually transmitted area. So if you have that means if you have sex with somebody else who has herpes, which likely you may because at least you're not giving them something they don't already have, then you can have double exposure to also getting HIV as well. So it would be best if you were to be on an antiretroviral drug just as a prophylactic reasons. So HIV counseling and testing per the CDC guidelines. Routine testing for 15 to 65 years old, pregnant females, or after sexual assault. Yes, all women who go in to have babies have an HIV test done, just basically because we know they've had sex, and also to protect the baby, right? They are all confidential and anonymous. Post-test counseling by trained personnel explain the test results. Assist with informing sexual partners and drug needle sharers. Here's the thing: is there was a law passed where nobody has to ever know that you have AIDS or HIV. That is a law. Meaning, I mean, beyond HIPAA, how would you notify somebody that they might have been exposed to HIV without telling them how? And that is the job of, the health department, because the health department does this. Whenever somebody comes up, like say you do an HIV exam or test on somebody, you bring them back into the office, and not only are you as a nurse going to be there, the doctor's going to be there, and also somebody from the health department is also going to be there to help them inform people who they've possibly been exposed to in the last couple of 6 months to a year. And then that you have to assure them that you will inform these people without letting them know who they've been exposed to. Now, the biggest advice you can give somebody who stop. Ugh. The biggest advice you can give to somebody who is going through this is that you don't need to tell anybody who doesn't have a need to know. Nobody needs to know this. This is your business, and you don't have to tell anybody unless they have a need to know. You don't have to tell family. You don't have to tell your friends. You don't have to tell anybody. Just those that need to know. So possibly healthcare, if you ever are in the hospital for something. And even then, they don't always have to disclose that. And that's why it's really important we always use universal precautions. Discuss risk factor reduction and give care options. So, for sexual transmission, the highest risk is anal sex. It's the greater risk to women. HIV infected reduced with PrEP, which is your antiretroviral drug. Early treatment reduces transmission to uninfected partners by 96%. So, safe sex practices is abstinence, monogamous sexual relationships, limit your sexual partners, condoms, dental dams. I know. What is a dental dam? I guess I'm old. I came up with this question, I think it was when I first started teaching. I'm like, what is this? And a friend of mine, this is for oral sex for women as a protectant. It's called a dental dam because it was used during dental procedures, but it's actually just like a sheet of uh, latex that is placed over the vaginal area during oral sex, and latex gloves. Injection drug use, we need to avoid it. Of course, do not share drug injection equipment. Clean equipment if you won't stop sharing it. PrEP reduces transmission risks. And during blood transfusion, try to use autologous blood, which reduces the risk, which is using your own blood. So if you know you're going in for a large procedure, donating your own blood to be used for emergency purposes is probably your best bet here. All right, so perinatal transmission prevention routine tests during prenatal care. Repeat in the third trimester for high-risk patients. If you're HIV positive, antiretroviral therapy, pregnancy, labor, and delivery. And the infant is given, that's it, zidovudine for 6 weeks. We have to start that drug immediately at birth as well. Prevention for healthcare workers, hand hygiene, personal protective equipment, standard precautions. When we have needle sticks, we never, ever, ever recap needles. We try to use needleless systems in most things, and always, always practice our needle safety devices. Post-exposure prophylaxis guidelines. Urgent medical condition. Wash exposure site with soap and water. Mucous membrane exposure, flush with water. Consider the risk. Test the source and treatment for 28 days. Begin within hours of exposure. Meaning we need to consider the risk. Like if I got poked by, let's say I gave insulin and I tried to recap my needle and I poked myself with the dirty needle that I just used on somebody giving them insulin. So I'm going to consider my risk. This is a 75-year-old woman who has Alzheimer's. I'm not saying that she's HIV free. All I am going to say is it would have come up by now. Okay? I mean, um, so am I going to get tested? Yes. Yes, why not? It's protocol. Let's do this. I got to get tested. She has to get tested for HIV. And I need to go ahead and do my prophylactic antibiotics and antiretroviral drugs. That's why needle sticks are so bad. It's because so many things have to be done because of them. So our signs and symptoms in 6 to 12 weeks going to be after being exposed, right? Fatigue, headache, fever, lymphadenopathy, diarrhea, and sore throat. Signs and symptoms are shortness of breath, weight loss, night sweats, persistent diarrhea, oral and vaginal yeast infections, dry skin or skin lesions, peripheral neuropathies, shingles, seizures, and dementia. These are all late signs. Late signs. Okay, so your final stage of HIV is an AIDS diagnosis. It's when your CD4 T lymphocytes count less than 200 per microliter, or opportunistic infections and diseases are happening. And this is CDC defined. Opportunistic infections are like yeast infections, thrush, shingles, like they said earlier. Those are all opportunistic infections. Those are happening because the immune system is compromised. AIDS wasting syndrome is a weight loss more than 10% plus for more than 30 days. Chronic weakness or fever or chronic diarrhea are all considered AIDS wasting syndrome. AIDS dementia complex is memory impairment, personality changes, hallucinations, loss of balance, slow responses, and safety is going to be important for these patients. Opportunistic infections are Candidus albicans is the most common. That is your yeast infection. Cytomegalovirus, um, pneumocystic pneumonia, tuberculosis, and other. So there's other ones, but these are the most common. This one being the most common one. Remember I was talking about Kaposi sarcoma, which is rarely seen with, sorry, I don't know what this is. Let me go and take my picture out. Rarely seen with therapy, but it used to be seen quite often. If you guys ever seen like Philadelphia, that's one of the things that came up, but they also get sores in the mouth as well. and they're very painful. So with the diagnosis, HIV antigen antibody combination test. This one, it's a blot test, the Western blot test, and this is just a screening. So if you were to test positive for HIV from a Western blot, you would have to get a second test, a nucleic acid test, to confirm. Okay, it's just a screening process. A CBC and lymphocyte count, a CD4T lymphocyte count, a viral load testing. You may need to know what those are. So, and a genotyping. HIV antigen antibody combination immunoassay and HIV antibody immunoassay differentiation test for HIV-1 and HIV-2, and of course the nucleic acid test. So initial evaluation of status of immune system, this will tell us where did you start. Whenever you test positive for HIV, they do want to get a CD4T lymphocyte count because that'll tell us where you started. That's like a baseline. And we don't want to lose too much from that point. It will identify the need for antiretroviral therapy. The normal is 332 to 1,642 cells. And HIV levels drop, so monitor during antiretroviral therapy. Viral load testing measures the amount of HIV RNA in the plasma. It shows response to antiretroviral therapy. This is important. It's going to be on your test. Viral load testing shows response to antiretroviral therapy. Within 1 month of antiretroviral therapy, we need to do a viral load test. Then 3 to 4 months in intervals for 2 years. Then every 6 months if the virus is suppressed. Goal is ultrasensitive, undetectable viral load. Genotyping measures the resistance to current antiviral treatment and guides treatment regimens. So general testing is going to be for syphilis, hepatitis A, B, and C, and a liver chemistry panel. Because a lot of times these antiretroviral drugs are hard on the liver, guys. Just like medications for TB, just like medications for long-term infections in general. Your liver's got to be up to par to handle these medications. There's no cure. We got to begin the antiretroviral therapy, and the goal of therapy is to prevent and delay opportunistic diseases and infections. Prophylactic interventions for hepatitis A and B, herpes simplex, Mycobacterium avium complex, and pneumocystic pneumonia. That means get your vaccines, right? All right, so as far as antiretroviral therapy goes, we want early aggressive treatment. Each drug class acts on different stage of HIV life cycle. Multiple drug therapy, there's 3 drugs and at least 2 classes of treatment categories. Reduces the viral load to undetectable levels and prolongs survival. The CCR5 antagonist medications block the CCR5 receptor that opens the host cell door to prevent HIV-1 entry into the CD4 cells. The fusion inhibitors block HIV fusion with CD4 cell membranes. And the NRTIs block the HIV reverse transcriptase, inhibits the reverse transcriptase viral replication. Integrase inhibitors block HIV from combining with its genetic code, and protease inhibitors bind to active sites of HIV protease enzymes and interrupt the formation of viral particles. So our nursing diagnosis is ineffective protection, ineffective coping, risk for injury, deficient knowledge, impaired gas exchange, diarrhea, and fatigue. Imbalanced nutrition, less than body requirements, impaired oral mucous membrane integrity, acute or chronic pain, impaired skin integrity, and risk for situational low self-esteem and social isolation. Our nursing interventions are going to be ineffective protection, hand hygiene, bathing, avoid sharing grooming items, wash your toothbrush. When I mean by wash your toothbrush, I mean like put it in the dishwasher, okay? Use clean dishes, duh. Report infection symptoms. For acute or chronic pain, identify the cause, medications, and complementary therapy like heat, cold, massage, and positioning. For fatigue, we're going to alternate activity and rest, prioritize activity timing. Imbalanced nutrition, we're going to identify interfering factors like weight, monitor caloric intake, consult a dietitian, have the patient eat small, frequent meals, and use antiemetics. The nurse would recognize the need for further teaching about HIV if the patient stated which of the following about HIV. Select all that apply. HIV is an acute infection. Okay, this one needs further teaching because remember, HIV is a chronic infection. It can be progressive immune disorder. Yes, it can. That is true. Over time, HIV can cause AIDS. Yes, it can. That is also true. HIV is curable. No, HIV is not curable. This needs help. ART increases HIV replication. No, it stops HIV replication. So 1, 4, and 5 all need more teaching. Yay! The nurse is assisting with education at a health fair. Which of these would the nurse include as modes of transmission of HIV? Select all that apply. Men who have sex with men? Yes, they can. Heterosexual contact? Yes. Handshaking? No. Injection drug use? Yes. Sharing dishes and utensils? No. So I'm going to say 1, 2, and 4. All right. The nurse is assisting with education at a health fair. Which of these would the nurse include as sources of exposure to HIV? Select all that apply. Blood, yes. Semen, yes. Tears, no. Vaginal secretions, yes. And breast milk, yes. 1, 2, 4, and 5. Which of the following would the nurse include when teaching about PrEP, which is your prophylactic antiretroviral? Prevention for those at high risk, yes. It is an antiretroviral drug, yes. It's a daily pill. It's not a weekly injection. Other transmission precaution, no, that's not true either. So 1, 2, and 5. The nurse experiences a needle stick. Which of these actions should the nurse take? Select all that apply. Wash the exposure site with soap and water. Yes. Seek urgent medical care. Yes. Flush mucous membranes with water. Yes. Begin order therapy within hours of exposure. Yes. Follow the treatment for 1 month, not 1 week, and test the source. Yes. So 1, 2, 3, 4, and 6. Oh, 1, 2, and 4. Oh, it doesn't let me go back. Okay, I was wrong.